Assalamu alaikum doctors. In this video I am discussing a video station, that is a recall video stations. Down syndrome patient showing snoring. Move his hand, then take the breath again. Obstructive sleep apnea. Ask for each team and what its rule. Okay, what history you want to do and examination you need to do. So that is a Down syndrome. We know Down syndrome feature how will be first of all hypotonic, upward slanting of eye. We can find the child they have single palmar crease, sandal gap, and short and broad hand. These are the actually features of Down syndrome. So especially the upper outer. The eye feature is especially Down syndrome and snoring the child. So it is obstructive sleep apnea. What we see, we will describe that the child is sleeping or snoring. What are the differential diagnoses? So on my top, it is obstructive sleep apnea. DD we can tell rhinotonsillitis, allergic rhinitis, then sinusitis, obesity complications, central hypoventilation, brainstem tumor. Okay, so what are the DD of obstructive sleep apnea? Adenotonsillitis, allergic rhinitis, sinusitis, and the obesity complication, brainstem tumor, central hypoventilation, and other any syndromic features. So Down syndrome is our case. So what history would like to ask? Onset, course, and duration. What make it better and what make it worse? So how many times occurring at night? Is there any cessation of breathing? Position during sleep? Non-refreshing sleep, nightmares, nocturnal enuresis, lack of concentration in the morning, daytime somnolency, school performance, then history of any abnormal behavior, teeth grinding and crowding, fever, recurrent infection in the throat and ears. So as usual, onset, course, and duration, what make it better, what make it worse, then how many times per night occur, is there any cessation of breathing like apneic the child, any fever, sinusitis, any teeth grinding, any teeth infection present or not, because these are aggravate this condition. Any syndromic features child has or not, because hypotonic child, Prader-Willi and the Down syndrome, they have sleep apnea develop. Family history, then the, of snoring, right, daytime somnolency, daytime headache, less concentration on work, non-refreshing sleep, nightmare, nocturnal enuresis. These are any recurrent infection in the throat and ear. These are we are asking. Any abnormal behavior. Okay. What are the examination we do for obstructive sleep apnea? First of all, ABC, vitals, oxygen saturation, weight and height and plot on the centiles. ENT and dental examinations, general examination for dysmorphism, cardiac and chest examination. So the examination we are doing the first of all ABC, vitals, these are we are doing. Then the child chest examination we do, cardiac examination as obstructive sleep apnea. It can cause that is cardiac condition can be developed. Then general examination for dysmorphism and ENT and dental examination. Now what are the investigation we are going to do? Investigation we are doing, number one, lateral x-ray of the neck for adenoid. Okay, lateral x-ray of the neck for adenoid, chest x-ray, overnight oxygen saturation and polysomnography, echo for pulmonary hypertension and right ventricular hypertrophy, myofunctional exercise by ENT. So lateral x-ray of the neck for adenoid, we can do the echo because pulmonary hypertensions develop, overnight oxygen saturations and polysomnography, chest x-ray. These are management involving consultant pediatrician, ENT consultant, cardiologist if needed, and dietitian. Intranasal steroid and adenotonsillectomy. So first of all, the cause are we are identifying. The child is obese, dietitian we are involving. ENT involved because ear, nose infections, dental infections, sinusitis is the cause. My pediatrician will be involved, and mainly treatment intranasal steroid and adenotonsillectomy, surgical treatment. So there is a question. Prader-Willi syndrome, why obstructive sleep apnea? So Prader-Willi syndrome, they have basal oxygen saturation should be done before giving growth hormone. Prader-Willi syndrome, we know that they are obese, that's why develop. And why Down syndrome has obstructive sleep apnea? Because they have short neck, large tongue, hypotonia, large adenoid, recurrent upper airway infections due to low immunity. So Down syndrome are short neck. They have recurrent upper airway infections. They have large tongue. They are hypotonic. For this reason, Down syndrome patient has obstructive sleep apnea. So obstructive sleep apnea, we understand the DDR, allergic rhinitis, sinusitis, obesity, central hypoventilation, brainstem tumor. And we do the investigation lateral x-ray of the adenoid, chest x-ray, echo for pulmonary hypertensions, my functional exercise by the ENT. And treatment are that is intranasal steroid and surgical treatment, adenotonsillectomy. And multidisciplinary team will involve ENT doctor, cardiologist, dietitians, and my pediatricians. So this is all about obstructive sleep apnea. Thank you.